So today I'll be doing my open circuit suctioning. I would have an order to open suction. I would of course review that and go, well, I think an inline suction catheter would be best for this patient, but quickly find out that we do not have those in the hospital right now. So again, check my chart, found out there's no contraindications. Gather my equipment, Yonker, lube, lubricant, saline for those thick secretions in the tubing so we can loosen them up and get them out. My NTS equipment, which is right here, sterile. My bag for my sputum collection, my labels for my sputum collection, and my sputum collection canister itself. Also, I have my goggles on, they're right here on my face. I also have my BVM bag, and attached to it is the PEEP valve, and it is connected to 100% oxygen. And just to test it out, it is working, no leaks. I would then, after gathering my equipment, knock on the patient's door, come in and state my name and what I'm doing. So hi, my name is Haley. I'm a respiratory student at Midlands Technical College. I'm going to be suctioning you today to get some of the secretions out your airways and hopefully help you breathe better. I would verify my patient's name and date of birth just by checking their wristband. It matches. I would wash my hands, put on my gloves, and after doing this, I would hyperoxygenate my patient. Now, while open suctioning them, I want to make sure that my catheter is the correct size, and it is. I'm going to go ahead and turn on and suction equipment, making sure that pressure is between 120 and 150, and it is. I'm going to hook up my sputum canister. Like so. I'm going to open up my NTS and sterilely put on my glove without contaminating it. I'm going to grab NTS catheter out, wrapping this part around my hand so it does not get contaminated. Inserting this part down here. Onto my sputum canister. Like so. And then hooking up this other part to it. I'm just going to check my pressure and make sure it is within that range, and it absolutely is. I'm going to hyperoxygenate my patient one more time. And between each time I pass through to suction the patient, I will have someone bagging him. I unfortunately have no one today, so we are just going to pretend someone is doing that for me. Okay, the patient is hyperoxygenated. We're going to take this off of him. We are going to start suctioning. Okay, it's going to be a little uncomfortable. Big cough for me. Going down, they're coughing, I'm going past that, hitting the carina, pulling back and suctioning on and off. Not holding my finger no longer than 8 seconds. Okay, listening to the breath sounds, it does sound like I need to go down again. Give them a breath. Go down one more time, big cough. They're coughing, hitting their carina, pulling back and suctioning and twisting, pulling back. My canister is filling, pulling back, pulling back, pulling back, twisting. And pulling this out and wrapping it around my hand. Pulling it off and pulling this tubing off. Not contaminating my sputum collection right here. Putting that down towards the side and taking off this contaminated glove and wrapping around this catheter and trashing that. Putting my patient back on the ventilator, that way they can breathe. As I was doing that, I would have been checking their sats and making sure they weren't desatting. Patient was fine the entire time. Patient took the procedure very, very well. Quick in and out is how it should be, so the patient does not desat, and if so, stop, use the BVM mag for an emergency. I'm going to label my sputum collection with the patient's label. Their room name, I'm going to write that on there. I'm going to signature it. I'm going to write how it was collected through ETT2. And I'm going to label that and the bag. I'm going to do that now. Again, just looking at my patient, making sure everything's right, making vent looks good, the numbers are good, their sats are good, that heart rate and the SpO2 is great. Before I leave, I'm just going to check that cuff pressure just to make sure it is in a good range. Okay, great, it is. I didn't do anything to that. Just going to assess my patient's breath sounds to make sure that I don't need to go back and redo it. Just listening. They sound great. No need to do it all over again. They sounded good after our suction, but we always just want to go back and make sure before we leave the room. After our suction the second time, sorry. After that, I'm just going to take off my gloves, take my disposable equipment I brought with me and trash it. Taking my sputum that I collected, at least 5 milliliters of it, and I'm going to take it to where it needs to go and drop it off so that way it can be tested, and yeah, chart what I've done and how the patient took the procedure, and that's pretty much it.